Back to the topic of the day, at least for the moment, the topic of health care. Senate Republicans aren't the only ones suggesting fixes to the now stalled health care bill. Republican governors are also weighing in, particularly those from states that expanded Medicaid under the Affordable Care Act. Republican Governor of Arkansas, Asa Hutchinson, is the latest to weigh in, urging Senate leadership to reconsider its cuts to Medicaid spending, saying it would place an undue burden on many of those states. Governor Hutchinson is joining me now from Little Rock. Governor, nice to see you. Thanks for being here. I appreciate it very much.
It's good to be with you and participate in the discussion.
I want to ask you, if I can, quickly about what the president said this morning. He suggested today that Republicans should take an alternate route if they can't pass this bill. He said, repeal now, replace later. Would you advise that?
That doesn't sound like a good idea to me. We're going through a lot of uncertainty right now with the current debate in Washington, and people want some understanding of the path to the future and what the future health care system is going to look like. We need to do that to change that course and say we're going to repeal Obamacare but not know what we're going to replace it with. We really give a lot of uncertainty and unnecessary worry. So we just got to slog through this. The Senate's doing a remarkable job trying to bring people together to have the reform that is so much needed in an unsustainable system right now.
So let me ask you, the uninsured rate in your state, I just checked the recent poll, I think, from not too long ago, was something like 10.2%, sort of on par with the national average. Your state of Arkansas, I think the state of Kentucky as well, are the ones that posted the largest drops in uninsured rates in the country right now. So with that as the backdrop, if the bill out there right now, the Senate bill passed, it would get rid of Medicaid expansion and cap spending on Medicaid per person. Your state, as we just noted, has benefited from that expansion that really only expands it to make those covered if they make something up to like $16,000, $17,000 a year. So what would happen to those individuals?
Well, on the Medicaid expansion, if we cease that, then they would have to go on the subsidized individual exchange, and many of them would not because the subsidy is not sufficient. And so these are people who are making the poverty level or around that, so they could not afford it. So clearly the number of uninsured would increase. It puts the states in a very difficult position because the federal government made a commitment of 90% cost share on the expanded population. Now they want to reduce it down to 70% in Arkansas, and so we could not absorb the extra $200 million per year that it would cost us. So the result is that we would do away with that expansion, and obviously that would have a lot of consequences for people who have relied upon that.
But, Governor, to be clear, you had called for, I think, the federal poverty rate, 138% of it is covered under the expansion. That's for folks who make like $16,500 a year. You said it should be knocked back to those at 100%, so much less than that. So the CBO says that those folks couldn't afford that coverage. So isn't that leaving people out in the lurch?
Well, this is reform we're already doing in Arkansas, and this is exactly what we've got to do, is to help those that need it the most, and concentrate our state resources and our federal resources on those. And so right now we're doing reform in Arkansas, and we're not waiting for Washington. We're going ahead and we're going to reduce the expanded population by about 60,000 in Arkansas. They have an opportunity to go straight on to the exchange under the current law, and they have adequate subsidies to get that insurance. So it's a seamless transition. But if it changes down the road under the new Senate plan, not going to be able to go on the exchange, then they will be uninsured, and that's a problem.
One frequent criticism right now is that this bill contains large tax cuts for wealthy investors, even as it cuts spending that benefits poor people. Do you think we should keep those taxes in place if it means more to help the most vulnerable in states like yours?
Well, that's the cost, and where you come up with the revenues is a Senate question. I'm delighted.
What's your position on this? Do you think we should keep those taxes in place for the wealthiest Americans, the wealthy investors?
I know that's under consideration by the Senate. They're debating that point. I want to make sure there's not a massive cost shift to the state. And as to how they avoid that cost shift to the state, I leave that to Senate. If they have to continue the revenue stream under the previous law, then that's one solution to it. If they want to shift other revenues, that's fine. Just do not have this massive cost shift to the state that would require us to abandon some of these programs that people are relying upon.
In Nevada, Senator Dean Heller says he's been working really closely with the Republican governor, Governor Sandoval, in that state. Would Tom Cotton vote for a bill that you did not support?
Senator Cotton and Senator Bozeman have been very attuned to what we're raising in Arkansas. We have a great working relationship. They're looking to their other colleagues and trying to address the issues that I raised. As to what they finally vote on, I don't know. They understand how difficult a position we're in, that what we have is not working over the long term. It's got to be changed. What's the best solution? And I'm giving my ideas, and I'm saying how this is going to impact Arkansas.
Right.
They got to make the best judgments from there.
Governor, final thought, if I can. Another big story making news right now. The administration's Voter Fraud Commission asking for extensive voting data from all states. Do you plan to comply with that request?
We have not received the letter yet, so we'd want to look at it in detail. By and large, I would be very hesitant to send out voter data that's available here in Arkansas into a national database. Even though it's publicly available information, I understand that they're requesting. We generally handle voter fraud issues state by state. I think we handle it well in Arkansas, so we'll wait and see what the letter says, but I'm a little hesitant about it.
Do you believe that millions of Americans across this country voted illegally in the 2016 election, or do you believe that there were tens of thousands of illegal votes cast in your state?
All I can speak of is Arkansas. I think we had a very good election system. It was fair. I don't think we had massive amounts of fraud. I think it was a very fair election, and we got the result that the people wanted.
Governor Hutchinson, we appreciate your being here. Thanks very much for your time.
Good to be with you.